Hi, I'm Megan Jackson. I'm a pelvic health physio, and like many of you, I work with people living with persistent or complex pain pretty much every day. And if you're anything like me, you were probably told early in your career that pain education is important, but not necessarily how to do it in a meaningful, time-efficient, patient-centered way, especially when you've got limited time, detailed history to get through, and a clinic list that's already full. So over the years, particularly working in people with chronic pelvic pain, I noticed I was reaching for the same explanations and metaphors again and again. But I also knew that what the evidence actually tells us, and that is that pain education works best when it's personalised, repeated over time, linked to real action, and delivered in a way that feels safe and collaborative, not one directional or overwhelming. So the pain deck grew out of that gap between theory and real-world clinical practice. I wanted something practical, something that helped me understand the person in front of me quickly, and then supported the conversations that genuinely move that treatment forward. So these cards are designed to help you uncover the beliefs, fears, and assumptions that quietly shape someone's pain experience. It's not a formal outcome measure, it doesn't replace validated questionnaires, but it is a really useful screening tool. You simply ask the patients to pick statements that feel true for them. So in seconds, you will know if you're dealing with fear of damage, avoidance, hypervigilance, low confidence, stress-related flare-ups, sleep disturbances, all the things that we know are so significant in contributing to people's pain experience. And because it's visual and it's patient-led, the process feels safe. And patients often say, yeah, that's the one, that's exactly how I feel, even if they struggle to express it verbally. So it kind of gives you a shared starting point. So once you know what they've selected, the explanation cards help you guide the discussion. They're grounded in current pain science, but written in clear everyday language, the same kind of language that I found works well in clinic. So rather than correcting people outright, the cards help you to gently explore what the belief means to them, where it comes from, whether it's helping or hindering their recovery. So it's collaborative, but not confrontational. And then there are the strategy cards. So these take the themes that came up, whether that's fear, movement avoidance, stress, sleep lifestyle, flare-up management, and they help you turn those into a treatment plan. So the conversation doesn't stop at understanding the pain, it sort of naturally then flows into, okay, well, what can we do about it? So that might be pacing, movement confidence, graded exposure, sensory regulation, breathing work, sleep routines, strength training. And the deck itself is split into two parts. You've got your belief cards, these are the statements that patients choose from, and then you've got your strategy and explanation cards, and these are the tools that you use to guide discussion and plan care. You can use as many or as few as you want, so you can pick a couple and do it in 5 minutes, or you can bring them all out and go into greater depth. So my aim with the pain deck is simple: to make pain conversations easier, clearer, and more effective for both clinicians and the people we support. So if you're looking for a practical way to screen beliefs, open up meaningful dialogue, and build an evidence-based treatment plan, I hope the pain deck will give you the same clarity that it's given me.